And hello again, this is Jane Houston, the Clinical Director of Midwifery and Women's Health at Frontier Nursing University, and you're all most welcome to our Digital Summit 2015. Today, I'm delighted to welcome Cara Osborne and Amy Romano to talk to us about Baby+Company. Cara Osborne has a Doctor of Science, Master of Science, and is a CNM, founder and Chief Clinical Officer at Baby+Company Birth Centre. She is a midwife by clinical training and also holds a BA in biology from Transylvania University. Her midwifery degree is from Vanderbilt, and she also has her master's and doctorate in maternal and child health from Harvard School of Public Health. Her main area of interest is perinatal epidemiology in the academic setting. Prior to coming to work at Baby+Company full-time, Cara was an assistant professor in the Eleanor Mann School of Nursing at University of Arkansas and a co-investigator for the American Association of Birth Centers Uniform Data Set. She is also a reviewer for the Journal of Midwifery and Women's Health and a technical advisor to the Board of Directors for Midwives for Haiti. Cara sees Baby+Company as a vehicle for dissemination of the birth centre model of care, an evidence-based, high-value strategy for maternity care that extends the range of options available to women and their families. Welcome, Cara. Welcome also Amy Romano, MBA, MSN, CNM. Amy has worked in the maternity care field as a nurse, midwife, research analyst, educator, and consumer advocate since 2001. As a nurse midwife, she has practiced in the home, birth centre, and hospital settings and taught in the Yale Nurse Midwifery program. She previously directed Childbirth Connections National Transforming Maternity Care Partnership and most recently worked at Maternity Neighbourhood as Vice President of Care Model Innovation and Content. Amy recently joined Baby+Company, where she is focused on building up midwifery workforce, creating leadership and professional development programs for the clinical staff, and managing quality improvement and innovative programs. Again, thank you so much and welcome.
Thank you. Thanks a lot, Jane. We're happy to be here, and we'll be talking a lot today about what we do at Baby+Company, and then sort of more broadly about the birth center model of care. I'm going to focus a little more on the evidence side and the business model side, and Amy will be talking a little more about how the model really includes and addresses provider issues. So in this first slide, we'd just like to say a little more about who we are. So Jane's given us a lovely introduction, and that's who Amy and I are as people. But as an organization, we're a community of healthcare professionals that are really interested in looking at the birth center model of care as a way to reset the standard and the expectations that folks have for their maternity care. We see the birth centers as hubs of activity and spaces that our clients can come to have the best birth that they can have, whatever that means for them, and on their own terms. And we love being a part of that team, and the rest of our team, our folks out in the birth centers and also our central support team, come to join us at Baby+Company because they want to be a part of this bigger effort. To take a step back and think a little bit about the evidence around the birth center model of care. Many of us are familiar with the National Birth Center Study, which was first published in 1989 in the New England Journal of Medicine. I was very lucky, along with other folks who have been faculty at Frontier, like Susan Stapleton, to be involved in the Uniform Data Set, which is the American Association of Birth Centers data registry. And from that data, we pulled together a little over 15,000 births that happened between 2007 and 2010 in birth centers across the U.S. The results of that study and the results of that work were then published in our own journal, in the Journal of Midwifery and Women's Health, and confirmed the value of the birth center model of care for women with low-risk pregnancies. Particularly, and we'll talk a little more about this, one of the ways in which birth center care really demonstrates its value is by having the ability to help women achieve vaginal birth and decrease cesarean rates. In the same vein, the decreasing the cesarean rate is only a good thing if it can be done without increasing rates of maternal or neonatal complications, and that's what we saw in the study. Beyond just the direct birth outcomes, we all know that breastfeeding is important for the first year and then 5 years of life in terms of risks of infection, risks of infant mortality, and particularly obesity, so basic health outcomes that we look for in the childhood population. And so we feel like the birth center model of care support for breastfeeding, early initiation, and then breastfeeding follow-up also helps support child health in those first couple of years. As we think a little more about experience and a little less about outcomes, we're really interested in having a family-centered model that's wellness focused and helps look at a more global approach to the family's health. We all, those of us who are clinicians, are very familiar with studies that say that women are more willing to change their large-scale underlying health behaviors when they're pregnant than any other time. And so we have a responsibility to really think about how the suggestions that we're making during pregnancy can affect the whole family's health.
So as we go about building a network of birth centers and really scaling up this model, we're doing it in the context of some big drivers in our healthcare system. Birth centers are not a new idea. They've been around for decades and really proven the value in the evidence, as Cara discussed, and also just in all of the communities where they are. But in the current healthcare landscape, where there's such a focus on cost, and there's really we've truly reached the point where the cost of healthcare in this country is unsustainable, and all of the efforts around healthcare reform are about really reducing the cost of care while either improving or at least staying neutral on the quality and the experiences of care. And maternity care actually represents one of the largest contributors to the healthcare bill for Medicaid insurers and for employer-based insurance companies. It's the #1 hospital-based condition that they pay for, and it's the most expensive. And it represents about $100 billion per year. And the birth center model can really reduce those costs over time, one woman and baby at a time. We're also seeing more consumerism in healthcare generally, because some of that is just driven by more information, the sort of network, social media age that we live in, where people kind of can connect and hear about the whole range of experiences and approaches to receiving care. And also with healthcare reform, people are paying more out of pocket, particularly people with employer-sponsored or exchange, insurance packages that they bought on the state exchanges have larger out-of-pocket expenses, more higher deductibles for their care, and it's driving a little bit of a sort of consumer-driven concern about the cost of care, as well as the experience of care. There are a lot more options these days, and with all of these factors at play and just an interest broadly in natural childbirth and in wellness and yoga and so on, we're seeing truly a very unmet demand for birth centers. So while birth center care still represents less than 1% of all births, a national survey of childbearing women conducted by Childbirth Connection, called Listening to Mothers 3, actually asked women who'd had a baby and were planning to have more babies, whether they would consider giving birth in a birth center. And 25% of women, that's 1/4, said they would actually definitely want a birth center birth for the next one, and 39% said they would consider it. There was also considerable interest in home birth as well. So we're seeing a major increase in demand, and indeed, we're actually recording this from the American Association of Birth Centers conference. And it's really remarkable to see the increase in so many people adding birth centers, or birth centers reaching their capacity and really needing to grow. So it's a really exciting time for birth centers. Another factor that's kind of going on in the background that's driving growth in this area is the increasing attention on the quality of maternity care. I've talked a bit about costs. We do in this country spend more than any other country on maternity care. And, that might be justifiable if we were getting good outcomes, but in fact, we're not. We have the highest C-section, or not the highest, but we have a high and until the last couple of years climbing C-section rate at about 1 in 3. We're behind most of our peer countries in outcomes like preterm birth and maternal and infant mortality. So against an average of 33% C-section, we're seeing 6% in birth centers. And the exciting thing that's going on is that there's been talk, I'd say in the consumer advocacy movement and just, among the midwifery community and so on about the too high cesarean rate. But now it's really come in as a major focus of quality improvement efforts in hospitals. Payers are starting to pay attention. And so particularly in low-risk women, which is what birth centers serve, there's a nationally endorsed measure, and all hospitals starting in January, most hospitals now, and pretty much all hospitals providing maternity services in January will need to be reporting on this measure of C-sections in low-risk women. So birth centers and midwifery care in general really represent a very viable and effective model for getting at that C-section issue, and particularly in particular, as well as some of the outcomes like breastfeeding and positive family experience that Cara discussed earlier. And I think I went over this on the previous slide, but these are just the numbers from that Listening to Mothers survey. And so again, 25% of women would definitely want a birth center birth for their next baby, and 39%. So together, that's most women really would either consider or definitely want this. And this may in part be driven by some of the news media that is really every couple of months we see a story about midwifery or alternative birth settings. Time, ABC News, a lot of web-based publications have looked at this issue with much more, I would say, nuanced and positive kind of approach than some of the previous media attention that we saw that was really about kind of the controversy and debate. So we're really heading into a time where this is seen as a positive opportunity to improve outcomes and experiences for women and families, and to reduce the cost of care.
So I'm often asked, as I'm talking to our hospital partners and to folks sort of out in the general public, if birth centers are so great, why aren't there birth centers on every corner? And I think there's a few clear barriers to growth, and that really have told the story of why birth centers haven't grown more. So in our current landscape, there's right around 300 birth centers in the U.S. that are known to AABC, and they account for less than 1% of the births, as Amy said, only about 15,000 out of the 4 million births every year. The birth centers tend to be run by dedicated individual clinicians or even non-clinicians who are dedicated to the model and enthusiastic. They're often seen as being outside of the traditional health system or outside of the formal health system, an alternative, or not a part of mainstream options. The reasons that that's been difficult to grow have to do with lack of capital for both site build out, quality management, marketing, and also the ongoing working capital that it takes to build a birth center once the building is actually there. An agnostic, if not hostile, relationship with hospital or physician groups in the community, and also with payers. And then, one of the biggest barriers really has been the fee-for-service contract structure that most commercial payers have used to pay for healthcare. That's particularly problematic because it's really based around interventions. It's based around doing things, and much of the work that we do in birth centers is about not doing something. It's about preventing the need for intervention and using intervention very judiciously. And so it's difficult in a system that rewards intervention to promote and expand a low intervention model and really have it grow and scale. At Baby+Company, our general approach in trying to get past the scale issues are to partner with health systems to really work inside existing formal health systems and to work directly with payers on the front end when we're entering a state so that we can get to a more episodic reimbursement that's not based around interventions or around actions, but is based around the value of helping a mom get through pregnancy and birth safely and in the right space for her. The ways that we as a company look at these specific barriers are around 4 things. In terms of capital, we've taken on private investment in order to be able to have the runway that we need to get a birth center not just open, but open and functioning appropriately. We've also recruited a team that includes not just Amy and I, although I'd like to think we're important parts, but a team of folks with a diverse set of backgrounds, including general healthcare, operational management, retail health, consumer services. So to really take a much broader approach outside of midwifery and really recruit folks who are good at the things that we as midwives are both not trained to do and attitudinally not strong in, things around things like systematic business operations and sort of the structural components that it takes to project manage a building project. I spoke a little bit already about partnerships, but it's important, particularly as a new organization, that our health system partners and payer partners and community organization partners all be people that are aligned with the model of care and who believe in the model of care and are willing to really buy in and be supportive through those first couple of years as the facility is getting up and running. And then the 4th part is around systems and infrastructure. One of the upsides of having a network of birth centers in multiple states and across geographic distribution, is that we can have some economies of scale around things that are necessary for each birth center to run, but are not things that are core to the consumer experience or the family's experience in the local birth center. Things like billing, HR management, quality control, technology. These are all things that as we learn from each individual project in each individual community, we're getting better and better at sort of the startup phase of the new centers. Today, we have birth centers in North Carolina, Colorado, Tennessee, and Arkansas, and we have other sites under consideration and moving in Florida, Texas, and South Carolina.
So we really believe firmly and are happy to be participating in Midwifery Week because the true key to success of this is happy midwives. It's so much a key to success that we put an extra P in the word happy, so I apologize for that. But we really see, there are a lot of people, as Cara mentioned, involved in making this a success, but midwives are really at the core of it, and the midwifery model is at the core of it. And so growing birth centers and having the really optimistic and frankly aggressive growth strategy that we have is really going to require that we sustain as well as build our midwifery workforce and protect midwives' values and practices as we grow, and not not sort of lose sight of that core value that's really at the center of everything that we do, and the practices that midwives bring to this that are creating those outcomes and experiences for families that we set out to do this for. So we've actually launched internally for now, but it might find its way out into the broader world, a Birth Center Happiness Project. And this is a new initiative that we're starting to really kind of focus in on that, having happy and well midwives, and who are really doing work for the love of the work. So making the love of birth work a core value of our company and keeping it a core value as we grow. Fostering midwives' ability to practice meaningfully and with dedication, and part of that is kind of stripping away some of those administrative and operational functions that often fall to the midwives in the smaller birth centers just because of the nature of the scale of that. And then to really look at burnout as not just something that could impact individual midwives, but really is a important issue for our profession as we as we work in partnership with obstetricians and gynecologists. There is a serious workforce shortage, and we need to both grow and inspire more people to enter the workforce, and also keep the people in the workforce working at their top capacity, and again with sort of the dedication and the values that they bring to that work. So we're really looking at what are the sources of stress. There's some that are intrinsic to taking care of babies. They like to come in the middle of the night, and sometimes birth is, takes a long time and those things. So we don't want to tinker with the care model. We want to tinker with the things that we can really address to reduce burnout. And so we're excited to be doing that, and we'll be sharing the results of this project as we continue.
So I've attached an annex here that just includes some photos of our center in Arkansas. And the reason I've done that is just to say that as we think about moving birth centers outside of that initial concentric set of rings, of the very center of that, where women know they want this, they're already convinced, and they need very little encouragement to seek out birth center care because they've already made the decision, to those folks who are in that second set of the Listening to Mothers survey of people, the 39% of respondents who said that they would consider it. One of the things that we found very helpful in pulling folks into the birth center is making the facilities really look like a place that you'd like to be. And sort of one of the things that has been a long-term goal and dream of mine is that people would look forward to their prenatal care and to their birth experience in the same way that they would look forward to going to a salon or a spa, and not see it as perfunctory or something that they were obligated to do, or that they were sort of enduring because it was the right thing to do for their baby, but that they actually enjoyed the experience. And so I'll just flip through these quickly, but in my public health training, one of my mentors was a physician called Paul Farmer, who is a public health and HIV infectious disease doc who worked on projects in places like Haiti and Rwanda that I was fortunate to be involved in. And one of the things that is most important to me is that we make the birth centers look like this, irrespective of the community that we're addressing. And so Paul's mantra is preferential options for the poor. And certainly at this point in the development of Baby+Company, we are really speaking to the first movers, to the moms who already know they want this and are willing to do whatever it takes to get there. As we move into our next set of expansion centers, we're really interested in reaching folks who may not know that they want this, but help encourage them to come into the model of care. And as we sort of look forward to the results that will come from the AABC's Strong Start grant, really looking at how birth centers can decrease preterm birth rates in a Medicaid population, we hope that we can work directly with state programs to make this something that is gains even more scale as we get beyond just the communities in which women are seeking out this sort of care today. So that's it for me. Amy, do you have anything else you'd like to?
No, I think that's it. But have a happy Midwifery Week to all of those who are listening to this during Midwifery Week. And thanks for having us as part of this program.